According to a new report by the CDC, the vast majority of deaths among pregnant women and new mothers in the U.S. were preventable. Around 700 women die from pregnancy-related complications every year in this country. The report says 22% of these deaths are happening during pregnancy, 25% on the day of delivery or within a week after delivery, and more than 50% a week to 1 year after pregnancy. The underlying cause for about 38% of the deaths were cardiac and coronary conditions, other heart-related problems as well, followed by mental health conditions such as suicides and drug overdoses, and then hemorrhage. So we need to talk about this. Joining us today, Dr. Payal Kohli. First of all, what is your reaction to this?
I was stunned. You know, as a healthcare provider, I thought we've been doing better and better with maternal mortality here in the United States, better access to resources. So I was shocked not only to see that most of them are preventable, as you just said, Alex, but also that we have had an increase in the maternal mortality over the past few years. And keep in mind, ladies, this is before the overturning of Roe versus Wade. So this is all pre-pandemic data. So what we expect in the coming years is perhaps even more of an increase, a huge wake-up call for the medical profession for sure, but for all of us as women too.
This study is tracking not just the moment of birth, it's a longer time spectrum. So what do we know about the highest risk time frame for these women?
And that was also a bit of a surprise because many of us, even here in the medical profession, say, oh, when the baby's inside mom, that's when it's the highest risk period, right? Because you've got two patients, you've got hemodynamic changes. But what we're realizing with greater than half of the deaths occurring in the year after, that's when mom falls through the cracks. That's when the mental health issues sort of hit mom. And that's when perhaps we need to think about focusing more research and more resources.
Yeah, there's been so much research that has showed women of color specifically do not get treated for postpartum depression. And even when they do, it goes undiagnosed and that sort of thing, which is a whole nother conversation. But when we talk about actual deaths, there's so many issues here. Like, what are women dying of?
So the biggest cause, if you put it under an umbrella, many different types of heart conditions, but really heart conditions. Heart disease is the #1 killer of men, women, and of moms everywhere. But this was a shocker to me, mental health as a close second. And that's the part I think where we really can do much better in terms of prevention. Even with heart disease, as a cardiologist, I believe that we can do significantly better. But it disturbed me to also see some trends, different races, as you said, Alex, having different reasons for dying. Again, pointing us towards maybe allocating resources differently.
What did you find among some of the trends? Because they did look at this between race, ethnicity, as well as disproportionate impact on some groups of people.
That's exactly right. So we have, Black women that are dying more of heart disease, and that could perhaps not just be underlying reasons in terms of their health, but also access to care, potentially because we know that many types of heart disease in mom can actually be preventable. So that was very upsetting to me. We're seeing Hispanic and white women dying more of mental health problems. So in that community, maybe that postpartum period where, you may not have a lot of support, may not have a lot of financial resources, that may be a higher risk. And Asian women, interestingly enough, dying of hemorrhage, which could potentially suggest possible either biological differences or, again, an access to care issue.
I know we're getting wrapped here, but really quickly, what advice do you have for women who are pregnant right now and are hearing this and it's shocking and scary?
I think I'm going to take the silver lining. I'm going to take the glass half full approach here, which is that most of these deaths are preventable. So with education, resources, and access to care, moms, we can do better. Any future moms, any moms you might know in your life, even if you're a man, the idea here is to get them connected with resources. And the CDC has really taken an active role as well in terms of forming committees to look at why this is happening.
Well, hopefully, because the key word here, preventable, we can save some lives by having this conversation.
We appreciate you as always.
Dr. Kohli, thank you. We'll be right back.